Welcome, everyone. Thank you so much for joining us today. This is the Aligned Modern Health Digital Doc presentation on autoimmunity. We are joined by Dr. Joseph Glowiak from the Aligned Modern Health Functional Medicine team, and we are so grateful that you've chosen to spend some time with us on this important topic. Before we turn it over to Dr. Glowiak, we'd like to introduce Aligned Modern Health, just a little bit about who we are and what we do, in case this is your first time joining one of our Digital Doc webinars. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider in the alternative medicine space. Alternative medicine simply means no drugs, no surgery. We really aim to get to the root cause of why you're feeling what you're feeling, instead of just focusing on one siloed symptom or condition, because we fully appreciate that each of our patients are whole, unique individuals. Each of our 18 clinic locations around the Chicagoland area are supported by several different core services. These services include a physical medicine practice, which is supported by chiropractic care, injury prevention and rehabilitation, athletic performance support, and clinical massage therapy. We feature an acupuncture and Chinese medicine practice, wonderful for benefiting physical pain, both acute and chronic, but also some intangibles like stress, anxiety, depression, sleeplessness and insomnia, men's and women's health and hormone balancing, fertility and pregnancy support, seasonal allergies. We also offer some other modalities under the Chinese medicine umbrella like herbal medicine, cupping, and moxibustion. We round out our services both in clinic and via telemedicine in several US states with our functional medicine and clinical nutrition practice. This is the practice from which Dr. Glowiak joins us today, and we like to say it's a really great way to look internally to better understand why we are feeling what we feel externally. This practice supports gastrointestinal disorders, autoimmune conditions, bloating, constipation, fatigue, migraines, hormone balancing, men's and women's health concerns, food sensitivities, and we also, of course, offer nutritional counseling as a part of this practice as well. Aligned Modern Health is in network with most major insurance providers, and we do offer free consults in case any of this has piqued your interest, but you'd first like to learn more directly from a provider, ask some questions, and get some answers before becoming a full patient. You are very welcome to ask those questions in one of our free 15-minute consultations. Speaking of questions, we absolutely encourage your questions here today around the topic of autoimmunity. At any time during the presentation, you are very welcome to type your questions into the Q&A feature of Zoom. The Q&A feature is that little icon with the 2 conversation bubbles, not the chat. Dr. Glowiak will be happy to answer your questions at the end of the presentation. All of that said, it is now my pleasure to welcome Dr. Joseph Glowiak.
Thank you, Janine. It's a pleasure to be here today. Again, thank you for joining us. I'm Dr. Joe Glowiak, and I am a functional medicine physician. I was trained as a chiropractor at the National University of Health Sciences, where there is a focus on primary care in the training. And I also completed a master's program in nutrition and functional medicine at the University of Western States in Portland, Oregon, which is partnered with the Institute for Functional Medicine. Today's topic is definitely near and dear to me because my wife found out that she has rheumatoid arthritis shortly after my son was born around 4 years ago. And so we have been navigating her health concerns together, and there are always ups and downs, but she is in a relatively good place. So I'm glad to share that. So when I say I'm a functional medicine doctor, what does that mean? Functional medicine is an approach towards medicine where we look at a person as a whole person. We know that there's various systems, but we're not going after symptoms. We're trying to find the root cause of the condition. And so we need to do some investigations to figure that out. A lot of times It involves different diagnostic tests, such as blood work, but we go beyond that. We use saliva testing to look at hormones. We use urine testing to look at metabolism. We use stool tests to investigate the microbiome. And we implement as natural treatment as possible when it's appropriate. But it's also important to know when a good referral to a medical doctor for medication is needed too. So we have all of this training and all of these tools available. And so oftentimes functional medicine is a good first step when you have a new condition that's popping up. Let's talk a little bit more about autoimmunity. What is autoimmunity? Well, autoimmune condition, it refers to a broad category of conditions, really. And the bottom line is that there's some kind of dysregulation of our own immune response. Usually, our immune system will recognize which cells are ours, but in these autoimmune conditions, what's happening is our immune system gets a little confused and starts to instead destroy our own cells and our own tissues. And so within the realm of autoimmunity, there's a large variety of symptoms, which depends upon which cells are being attacked. So genetics, environment have to interact. And for example, our diet might have something to do with what genes are being expressed. And also, if we get an infection, the genes related to our immune system are engaged in different ways. So all of these variables come together and can start to cause the immune system to become dysregulated. Autoimmune conditions, the intensity of the response to your immune attack may increase or decrease over time, so symptoms can wax or wane. And it's always our goal to try to put these symptoms into remission by relaxing the immune response. Different autoimmune conditions may display similar symptoms among one another, so that could make it very confusing to diagnose these conditions, because a patient with rheumatoid arthritis might also have very similar symptoms in terms of hand pain as another patient who has systemic lupus erythematosus. And lab testing can help to differentiate, but sometimes can be somewhat inconclusive. Two people with the same condition may also have slightly different constellations of symptoms as well. So the same condition might be present for one person and another, but they might have a variety of different things going on. So that's what makes this sort of a challenging condition to diagnose and to treat. How does functional medicine determine our immune response? Well, there's a lot of different tests that we employ. A lot of these are the basic ones that I use to screen almost every patient that comes through my door anyways. We want to see what the white blood cell count looks like. It can tell us how healthy the immune system is. For example, if there aren't enough white blood cells, that might show that the immune system is weak in that moment. Or if there's an overabundance of white blood cells, that might show that there's too much activity going on. And the types of white blood cells that are shown in this panel might indicate whether there's a virus or a bacteria or a parasite or any other kind of infection that we might think of. We also look at the total antibodies. Immunoglobulin is a fancy word for antibody. And there's various categories of these antibodies. IgM antibodies are typically the first ones that we make when there's a new infection. But then after some time, they will transition away to making, the immune cells will transition to making IgG antibodies instead. These are proteins that the white blood cells make to go after pathogens and try to stick to them and identify them to be destroyed by the rest of the immune response. And so antibodies are sort of an important part of trying to assess autoimmunity as well, because sometimes our bodies make autoimmune antibodies. That's not the only way we can have an autoimmune response, though, but that's oftentimes one thing that we're wondering about. Another test that we use to gauge how much inflammation is going on in the body is the erythrocyte sedimentation rate, or ESR. And this measures how fast red blood cells settle to a bottom of the test tube. And so if they're dropping faster, that indicates that there's higher inflammation. If they're dropping slower, like snowflakes, then there's less inflammation, and that's what we want to see. So that's a more archaic, maybe a more old-fashioned test to look at inflammation, but it still applies because sometimes the ESR is really high, but the next one, the C-reactive protein, might be low. And so we don't always get an equal amount of inflammation presenting from all the various tests. They might be coming, we could see, inflammation higher from one marker compared to another. And so it's important to look at all of them. The C-reactive protein is actually a protein made by the liver in response to mostly neutrophil activation. So when the neutrophils are active, and those are the types of white blood cells that fight against bacteria usually, but they might also be involved in the autoimmune process. And so we might see high C-reactive protein levels in autoimmunity as well. So these are some of the foundational tests that we look at, and the antibody titers might be a next step type test that we look at to try to see if there is some kind of autoimmune antibody. Usually the titer means what's the concentration of an autoimmune antibody in the blood. And so that could tell us the extent of the autoimmune response that's taking place. And sometimes we could make goals around reducing the amount of antibody that we see present in the blood. We always want to remember when we're thinking about autoimmunity that there are some basics that help every person stay healthy, but especially these become important for autoimmune patients. Sleep, reducing your stress, getting the right amount of exercise, not too much and not too little, and also eating really well. And so sometimes it helps if you have lifestyle coaching from one of our nutritionists or from us as functional medicine doctors as well, to help to monitor whether all of these basic fundamental aspects of your health are going well, because this can really also change the course of the condition. Next, we're going to talk about some of the examples of autoimmune conditions that we put together for today. We categorize these broadly as either being seropositive. Sero means in the serum, and that means that we can possibly detect these conditions in someone's blood work, or seronegative, which means that we wouldn't be able to necessarily detect this in the blood work. And we'll talk more about why some of that can be in just a few slides. But under the seropositive category, we show rheumatoid arthritis can show up in the blood work, and so could systemic lupus erythematosus. Under the seronegative category of conditions, we look at psoriatic arthritis, and then surprise, we also see rheumatoid arthritis sometimes in a seronegative space. And so that makes things very confusing, because the same condition can be undetected in the blood, but sometimes detected in the blood. And again, that makes the job of the rheumatologist or the primary care doctor or the functional medicine doctor, as it were, a little more difficult to figure out what exactly is going on for this patient. So let's talk a little bit more in depth about rheumatoid arthritis. First of all, patients will usually complain of symmetric arthritides, inflammation in the joints that affects usually hands and feet on both sides of their body. It could be symmetric. And other joints can be affected in asymmetrical ways too, any synovial joint, any joint with a synovial membrane may be affected by this condition because the attack is usually going to involve destruction of synovial tissue. Also, what can make detection tricky is that we have, and this is where we were talking on the last slide, we have some autoimmune things happening in the systemic circulation, but sometimes these autoimmune responses are taking place in lymph nodes. And lymph nodes are a little more specific and regional, and so we might not see what's happening in a specific lymph node, whether it's in the armpit or near the lungs or near the joints of the body. So sometimes we can't detect some of these autoimmune markers. But again, some of the key markers that we look at are the generic ones we just spoke of, the ESR, the CRP, a CBC, a blood count. And then for rheumatoid arthritis, rheumatoid factor could be positive, as well as these special antibodies called anti-cyclic citrullonated peptide, or anti-CCP antibodies. So these could be possibly pathognomonic for rheumatoid arthritis, or at least send us in the direction of thinking about rheumatoid arthritis. But oftentimes, other autoimmune conditions can also display rheumatoid factor. So it's actually kind of non-specific. In addition to that, around 40% of rheumatoid arthritis patients can show anti-nuclear antibodies. And anti-nuclear antibodies are also seen in multiple other autoimmune conditions. But rheumatoid arthritis patients could also have 40%, 40% of them could also have that. Here are some of the findings that we might see on imaging. We could see that the phalanges, the finger bones here, are drifting towards the outside of the wrist, towards the pinky finger. This diagram shows some of the hot spots where rheumatoid arthritis may take some of its damage. Specifically, I want to point out as well the cervical spine, where destruction of elements of the axis and atlas, which are the first two cervical bones in the spine, are going to create instability of the skull on those first two bones. And so the views that we're showing here in this picture are called flexion extension x-rays, where we can see that the skull is shifting further away in each one of these. So in the extension, it's further away than in the flexion. We could see that it's unstable there. So patients can have neck pain. They could have neurologic symptoms also related to the spinal cord or spinal nerves being compressed by this excursion, the change in space here where the spinal cord should be going. In addition to that, splenomegaly could be found in rheumatoid arthritis. Usually the spleen is much smaller on an MRI or a CT scan. I think this is an MRI. And so certainly we can see that, this could be a feature as well. And the reason why is because the spleen is really another lymph tissue. So the lymphocytes involved in the rheumatoid arthritis destruction can start to enumerate in this tissue. So that's why we see the splenomegaly, enlargement of the spleen. Systemic lupus erythematosus is sometimes often confused with rheumatoid arthritis. Lupus or SLE primarily occurs in women, though, and oftentimes during the childbearing years. It can affect almost any organ system because the attack is on connective tissues. It mainly involves, though, joints, skin, sometimes the kidneys. The blood cells might be destroyed in the process. So we call that a hemolytic anemia, and also nervous system tissue. It causes fatigue. Patients will present with fatigue, sometimes fevers that come and go. Sensitivity to light can occur, sometimes chest pain, even ulcers in the digestive tract, and once in a while seizures can happen. One other thing to note is that lupus can also cause blood clotting issues, which can, in a pregnant woman, lead to miscarriage. So this is one of the conditions that I start to screen for if any woman comes into my clinic saying that they've had some history of miscarriage. I want to rule this condition out. Some of the markers similar to rheumatoid arthritis, we would look at the generic ones, ESR, C-reactive protein, the white blood cell count. Specific for lupus, if I'm suspecting it, I will run a direct Coombs test to see if there's some kind of hemolytic anemia. So this test is looking for signs that red blood cells are being destroyed in the autoimmune process. And in this condition, 95% of patients will show some kind of anti-nuclear antibody. In addition to that, we've learned a lot about anti-nuclear antibody in the recent decades, and we've been able to subtype anti-nuclear antibody. So anti-nuclear antibody itself refers to a huge number of different specific antibodies that all sort of attack the nucleus in different ways. And these subtypes refer to what protein or what structure within the nucleus these antibodies are attacking or sticking to. And so we can have double-stranded DNA antibodies or antibodies against the Rho protein or antibodies against the La protein, or we could have anti-ribosomal antibodies. And so sometimes these antibodies can be detected and subtyped, and that can be important for understanding exactly what's going on physiologically. Lupus, these are some of the characteristics that we might see, some of the features we might see outwardly. Lupus actually refers to the wolf, and I think initially when this was named, this butterfly rash looked like sort of the highlights or the markings on the wolf's face. And so that's why it got the name lupus. But you could see that this might look different depending on how much pigmentation is in the skin. You can also see that lupus is a lot more consolidated to hands versus being everywhere throughout the body. But hands are a really important part of our bodies that we use every day. So obviously this is very serious, even though it's not as widespread. You can also see that some of the organs affected would include like the heart. You could see that enlargement of the heart could take place. We could see this on a chest X-ray. So a chest X-ray could rule this out or show us that it's there, that it's present. In addition, the pleura are the membranes surrounding the lungs. And what can happen is there could be some swelling, some fluid that collects in between the lungs and the membrane of the lungs. And so we call that pleural effusion as well. We can see that with systemic lupus. Sometimes long bones can be affected by lupus, where there's a form of avascular necrosis that takes place. What's happening there is the small, arteries that feed the long bone are being attacked and shriveling, and there's a loss of circulation to certain parts of a bone. And so then there's necrosis occurring in the bone, actually, at those sites. We also can sometimes see on a hand X-ray that there's what we call calcinosis circumscripta, which are actually calcifications in the soft tissue, and rheumatoid arthritic type changes in the bones, although this X-ray is different from the one we chose to show the rheumatoid arthritis changes, but some of the erosions in the joints of the fingers could look very similar. And then we move on now to psoriatic arthritis, which is an example of a seronegative arthritis. And the symptoms can be somewhat similar, affecting the hands. In this situation, psoriasis can precede the joint changes. And sometimes it could be years and years before, or sometimes it could be just before. Rarely it's going to happen at the same time as the joint pain, but oftentimes I would say we're looking at psoriasis occurring less than 10 years prior to the onset of joint pain. And only about 1 in 5 patients with psoriasis will develop joint pain. So they may not develop all of these joint symptoms related to the autoimmune response. In about 15 to 20% of patients, it might happen the other way around, where the condition begins with joint pain and then turns into psoriasis and joint pain. So there's not a definite pattern for this to occur. We talk also about some of the findings of the fingernails that you can see with your eyes. And that could include what we call Bowes lines, which are horizontal lines that go across the nail bed. We can also see sometimes onycholysis. Onycholysis is where it appears that the fingernail is coming away from the actual bed of the finger. We can also sometimes see splinter hemorrhages, which are areas where the blood, where the capillaries are more visible and appear to be taking on damage, and also different types of nail pitting. But the inflammation and pain of psoriatic arthritis is often in distal joints, the ones that are further away from the spine. And sometimes they can also occur in the spine. So again, symptoms could be pretty widespread. There aren't, because this is a seronegative condition, there aren't a huge number of specific markers in the blood that can identify it, but you will see that the ESR and the C-reactive protein may be elevated in this one, as well as a white blood cell count increase. Rheumatoid factor is negative, and oftentimes only in 5 to 9% of patients will show rheumatoid factor in their blood. ANA is also oftentimes negative in this condition. Sometimes we could see in a little more than half of patients, we could see that those antibodies, the IgA antibodies, are elevated. And in a few more, maybe half to 3/4 of patients, we could see that this marker related to the immune system called HLA-B27 is positive. But again, 1/4 of psoriatic arthritis patients may not have that finding, so making it very difficult for us to identify. The reason why psoriatic arthritis is probably a seronegative one is because it is mediated by neutrophils and T lymphocytes, and they are probably very local to the area that's being attacked. So we won't see a lot of specific antibodies, like we said, and it's the neutrophils and lymphocytes that are causing this. Here's sort of our skeleton showing the areas of the psoriatic arthritis involvement. And there's really 2 main types, subtypes of psoriatic arthritis. One is called an asymmetric oligoarthritis. The other one would be more of a symmetric polyarthritis. So in the symmetric polyarthritis, you might see both hands involved or both feet involved. Or in the oligoarthritis, the asymmetric oligoarthritis, it might be one knee on one side of the body and maybe the shoulder on the other side. It could be the knee and the shoulder on the same side, though. The SI joint is oftentimes involved, though. So when imaging of the SI joint is done, and if there's signs of sclerosis there, we might be able to identify that that's what's going on for this patient, in addition to some of the signs that we would find on an X-ray of the spine itself. So let me show you what I mean there. On the spine itself, very characteristic, if we look to the right here, very characteristic of psoriatic arthritis would be these juxta-articular ligaments that are ossifying. So normally we won't see this sort of rounded bridge going across two of the spinal bones that we're looking at here, two of the vertebrae. On the hands, you can see that the pencil and cup deformity is pathognomonic for psoriatic arthritis. Pathognomonic means if we see this kind of deformity in a hand X-ray, that would be our prime suspicion for the condition. And some erosions are a little less apparent that it's pencil and cup. So different variety of presentation there. In guttate psoriasis, that's going to be widespread, oftentimes on the torso, looking more like discrete rash type presentation. And then here's a picture of scalp psoriasis as well. So what do we do in functional medicine when we identify one of these conditions? Well, we always should offer the opportunity for patients to confer with a rheumatologist. I think that's a very important step. Traditional medical treatments, though, usually include medications that suppress part or all of the immune response. We're talking about a category of drugs called DMARDs, disease-modifying anti-rheumatic drugs, or non-steroidal anti-inflammatories. Oftentimes, corticosteroids are also involved. But in recent years, newer medications such as JAK inhibitors and biologics like monoclonal antibodies are used. And sometimes those drugs, or oftentimes, those newer drugs come with black box warnings where infections or even malignant cancers or sometimes blood clotting can be caused by these medications. So it's really important for the rheumatologist to make sure that you're a good candidate to take the medications that they're prescribing. And you should always be aware of what some of the side effects or some of the warnings would be about the medications. And so because suppressing the immune response could be kind of serious, you need to sometimes be tested for conditions like tuberculosis or certain viruses to make sure that you're a good candidate. So in functional medicine, we offer some alternatives. If medication is truly necessary, these could be adjunctive to medications, but also if the course of the condition is not that advanced, you might forego some of the medications. It's your choice whether you want to take those drugs or not, and instead use things like immunomodulatory herbs to change the course of the condition. So sometimes key nutrients or herbal supplements can push the immune system away from engaging white blood cells that are causing destruction related to the autoimmunity. There's a hypothesis out there that there is a type of polarization that occurs for autoimmunity where helper T cells, helper T cells type 17 are going to engage destructive behaviors by your immune system. And sometimes the other helper T cells, we call them helper type 1 cells, can be helpful in reducing some of that Th17 response. And that is probably a larger discussion for another day, but I wanted to introduce that concept that we can sometimes sway the immune system in a different direction. Nutritional counseling can also help to modify how your immune system, such as, gluten-free style diet, dairy-free diet. There are the common autoimmune foods, usually gluten, dairy, corn, soy, etc. And then another important aspect of functional medicine care for autoimmunity would be uncovering what some of the initial triggers of the autoimmune response were. So a lot of times gastrointestinal pathogens can be the cause, the initial trigger that sent your immune system off in the direction of targeting your own tissue. About 80% of our immune system exists in our GI tract. So that's why it's one of the first things I think about for any autoimmune case. Food sensitivities can also develop out of these gastrointestinal imbalances. If there's some kind of inflammatory pathogen, then the foods that you eat around the time that that pathogen is present may also become a target to your immune system. And because we talk about things like molecular mimicry with autoimmunity, having an antibody against, let's say, gluten, for example, you might, every time you eat gluten, you might be promoting antibodies that are also involved in the autoimmune process. So testing for food sensitivities could be important for that patient. Other pathogens, though, too, outside of the GI tract, like mold, tick-borne illnesses like Lyme disease or Bartonella, Streptococcus and Staphylococcus infections are oftentimes involved in like rheumatoid arthritis. Organic pollutants and heavy metals, these are two different types of toxic substances for our bodies. Organic pollutants come from the chemicals that we use in agriculture. They come from the chemicals that we use in industry for plastics and things like that. Heavy metals are just present in our soil. They're present in manufacturing processes as well. And these substances can stick to our own proteins. And when the immune system discovers these, they're going to attack, of course, the tissue that is attached to heavy metals. And we call those, in those instances, haptens. Haptens are a complex of like a heavy metal or a pollutant that are attached to part of our tissue. And sometimes drug hypersensitivities can initiate autoimmunity as well, where the medication we take is attaching to our cells abnormally or our tissues abnormally and causing an immune response there. Counseling during stressful life events is really important. And oftentimes patients will remember that something stressful occurred to them at the time when this joint pain started, or at the time when this, skin condition began that is related to the autoimmune condition. And so we want to make sure that every patient has a support system, family members or friends that they can talk with. Other services that we offer that could be additionally supportive for these types of problems would be acupuncture, massage therapy, even sometimes chiropractic manipulation, meditation, having healthy patterns of exercise, things like that. Oftentimes as functional medicine doctors, we're thinking about adrenal imbalance and we're testing for high cortisol levels or low cortisol levels at various points during the day. So this is what we have prepared for today. I'll go to any questions in the few moments that we have left.
Thank you so much, Dr. Glowiak. We really appreciate your time today, and we hope everybody that has joined us live has found this informational and beneficial. Just a reminder that we are in network with most major insurance providers for specifically functional medicine and nutrition coverage. We are in network with Blue Cross Blue Shield PPOs and Aetna. If you have any questions about insurance coverage, or any questions about Aligned Modern Health in general, you are very welcome to give us a call at 773-598-4387, or you can visit us online at alignedmodernhealth.com. You are welcome to type your questions into the Q&A feature on the Zoom platform here. That's the feature with the two little conversation bubbles. We do have a question about a recording of this. Yes, this webinar has been recorded, and everybody that has registered for the webinar will receive a copy of the presentation just as soon as our digital team has a chance to format it for on-demand viewing. So yes, those of you asking about watching a portion that you may have missed, you'll absolutely have access to watch on demand. We have a couple of questions coming in about some other autoimmune conditions. Of course, this was just a 45-minute presentation today. We had to pick and choose the conditions that we spoke about. So for those of you asking about other autoimmune conditions specifically not covered today, like Hashimoto's and a few others coming in here, for today, we would suggest scheduling one of those free 15-minute consultations. Again, just in the time allotted we have today, we want to stay relevant to the autoimmune conditions that we've covered, but these are very important questions and we want you to get the answers that you're looking for. And yes, functional medicine can support patients with a variety of different autoimmune conditions, not those that we've only covered here today. So again, please go ahead and schedule that free consult so that you can get your questions answered by calling 773-598-4387. Or again, you can request that free consult online at alignedmodernhealth.com.
And I thought I would mention too that I work out of both the Elmhurst office and the Lincoln Square office in Chicago.
As well as via telemedicine. So you can see Dr. Joe Glowiak via Zoom as well. Mm-hmm. Dr. Glowiak, you had mentioned a correlation potentially between autoimmune response or inflammation and cortisol levels. Can you talk a little bit more about that, please?
So the cortisol levels can have some implications in the autoimmune process. Cortisol is definitely used by the body as a stress hormone, but there is another hormone related to it, cortisone. And oftentimes when inflammation is getting out of control in our bodies, cortisone is going to be released in higher amounts, but it does convert back and forth between cortisol and cortisone as your cells dictate. So when we see high cortisol levels, we're not sure if it's kind of like a chicken or the egg thing. We're not sure if it's in response to all the inflammation that's there, or if there was a stressful event leading to all this cortisol that then triggers cortisone to be made, which then can start to dysregulate some of the immune response, making some of your immune cells less aggressive at clearing pathogens or having an imbalance in the response against those things. So does that help with the answer?
I think so. Thank you so much. Mm-hmm. Any other questions specific to the autoimmune conditions we've covered today? We have just another moment or two for questions for Dr. Glowiak. But again, if you have questions about other autoimmune conditions that we did not cover, please do not hesitate to schedule that free consult with Dr. Glowiak via telemedicine or at our Lincoln Square or Elmhurst location, or with any of our functional medicine providers that are convenient to you. I don't see any other questions coming in through the chat, so we are going to say thank you so much for joining us today. Our next digital doc presentation is coming up on Thursday, June 27th, I believe that's the date, and the topic of conversation will be pain management, and we will have both a physical medicine and an acupuncture perspective on pain management. You can register for that webinar at alignedmodernhealth.com. Dr. Glowiak, thank you so much for your time today, and those of you that have joined live, thank you for your time as well. Cheers.
Thanks so much.